Harmonization is bringing all players under one umbrella, to be able to implement one plan, the National Strategic Malaria Control Plan, under the umbrella of the same monitoring and evaluation framework. And so everybody's focused towards the same plan.
Without harmonization, you see that partners are it is skewed. Resources are actually skewed to particular areas and particular states because there's no good harmonization. There's nobody coordinating it at the national level.
Before harmonization, of course, you could imagine that people were just doing their own thing, not focusing on the same national strategy or plan.
When you send goods, commodities to the lower level, is usually through a push system. The logistics system was very weak.
About SuNMap and all the support they give is that they're always pushing for a common front and common focus and galvanizing energy around the same goal, and so that is quite unique.
Together we sat down, we designed the system, and we were able to build capacity of the states. Our partners were able to come together to have a good system design. Now this is the way, though it's still in the infancy stage, but we have a system design that, this is the program we actually want to use to push the malaria program. And in terms of, also having policies that guide implementation, we've been able to sit together at a table to develop good policies and also good tools that will be able to, make us implement programs better in Nigeria.
We have a common plan, and the harmonization also pushes for coordination framework, similar coordination framework at different levels.
The supplies, and also in actually having good forecasting for the country. We're now able to forecast well, to quantify the amount of commodities that we actually need to push down to the lower levels, downstream. So that was a big challenge. But with having a good logistic management information system before, partners were able to come together to harmonize efforts towards defining the logistics system that will work for the country.
We ensure that all players have operational plans, that will drive their activities for the whole year.
One great success that we've been able to have in Nigeria is the LLIN distribution, and we keep selling it. Because for the LLIN distribution, for our states, we've been able to move to a very low figure of less than 2 digits to about 80% in terms of the distribution. If we've been able to move to a usage from less than 2 digits to about 45 to 50%, we have actually done a lot. And we've also brought in, beyond the traditional methods of behavioral change communication, other innovatives like engaging the Interfaith Association and also using the community-directed intervention in pushing demand. So the next survey that we're doing, we're expecting actually to see better results in terms of utilization. And if you look at the country also as a whole, to distribute over 50 million LLINs in Nigeria, it's great achievement, and you can't say you did that alone, or the program or anybody or any entity would have done it alone. It's because of the partnership that exists in Nigeria and the harmonization that the partnership has been able to stand.